Great. Roxy, do you think we're all set to get started?
Please go ahead when you're ready. Thanks so much.
Okay. Hi, everyone. Welcome. I'm Jacqueline, and I'm really delighted to be joined today by Dr. Anthony Lim of Mount Sinai Beth Israel Hospital. He can introduce himself a little bit, and we will get started about COVID-19 vaccine questions, safety, efficacy for young children. So thank you, Dr. Lim.
Hey there, folks. It is always a pleasure to spend time with you all, especially in the sort of opportunity to answer questions and concerns and address concerns that you may have about your kids' health and the impact of vaccinations and sort of where all these things are at this point. My name is Anthony. I am the Director of Pediatric Emergency Medicine for the Mount Sinai Health System, and I'm the Medical Director here at Mount Sinai Beth Israel, and have been having the most wonderful time with you all for the last, unfortunately, 2.5 years, plus some. And so for anybody that is new, even long beyond that, I've been part of the MCC family. My son went to school with Jacqueline at when he was in preschool. And so I really have a long-standing devotion to the work that you all do there and the children that you all have there as well. So really with that, Jacqueline, you just want me to chat a little bit and then we'll pick up some questions. Okay, great. So
that sounds great. And so if anyone has questions, feel free to put them in the chat. Dr. Lim will speak a bit about vaccines, but you can just throw your questions in the chat. And when he's done talking, I'll do a little bit of a moderated panel.
Great, fantastic. Yeah, so COVID. So where we are at now is that the newest variant, the BA.5 variant, is quickly and soon to be the most common COVID variant that is out there. Compared to, gosh, the way that they will compare these is if this is X% more contagious than the previous variant, which then builds on the previous variant. So the easiest way to put this is that the BA.5 variant is at least twice as contagious as the original and the Delta, and more contagious than the Omicron variant. What we're seeing is that there is a sort of slowly wavering up and down with regards to cases that we test. It's actually getting a little bit better in the Northeast as it is getting a little worse in the rest of the country. But what we're not seeing is a correlational increase in the number of hospitalizations. We're seeing maybe 100,000 or so cases a day in this country. We think it's probably much more than that because most of us have now gotten used to doing antigen tests at home and then managing symptoms at home. So it's very likely that the actual number of folks that are getting COVID is probably looking more like Omicron in the winter than it was before. That being said, as I said, most people are getting used to testing and treating at home. Most folks have been managing this at home. We have seen some folks in the hospital, but we haven't seen an overwhelming rush in hospitalizations. This is in both, adults and in children. What we will see and what we have seen, and this is specific to sort of pertinent to our discussion now, is that we are still admitting kids with COVID. COVID is a respiratory illness, and just like most respiratory illnesses, like flu, like RSV, that they do tend to more disproportionately impact the younger kids. And so children that are, up to 2 years old are the most admitted group of children, especially when they get respiratory illnesses. And that's for a lot of reasons. One of them is they're smaller and they have smaller lungs and they have less capacity. And in children of that age, their breathing is so tied to their drinking and eating that a little bit of a respiratory illness like a cold can, as you probably have seen in the past, really impact how much your child eats and drinks. And so whether children are getting admitted for the actual respiratory illness that COVID causes, or the dehydration that subsequently happens when kids are just sort of like laid out, the children of that age range are especially susceptible to getting admitted. Again, sort of pertinent to our discussion today, as now we have the option and availability of a vaccine that can potentially prevent these hospitalizations. And so, yeah, pertinent to our discussion today. A couple of weeks ago, both Pfizer and Moderna were approved under emergency use authorization to offer their vaccines all the way down to children to 6 months old. There are a couple of differences between the two vaccines, mostly in the way that it relates to how many shots you have to get, how far apart they're going to be, and the protection that they confer with regards to COVID. What I will say is that for both vaccines, they are ultimately supremely effective in keeping children out of the hospital. So preventing severe disease. It is just like what we've seen in adults. No matter what percentage the vaccines offer with regards to preventing getting COVID, period, they are generally equal in preventing severe manifestations of illness. So hospitalization, admission to the intensive care unit, death, those things. They have always been, again, smaller in children, but the difference between the 5 to 16-year-olds, which we had spent vaccinating in the last 8 months or so, and the 5 and below, is what I've said, is that those younger children are more at risk for getting hospitalized. And so the benefit that vaccines offer with regards to preventing severe illness is much more pertinent in this younger age group. So let's do a little bit of nitty gritty, and before everybody glazes over, I'm sure we'll review them in some questions as well. So Moderna is a 2-shot series. So you get it the day 0, and then you get it the second dose around day 28, and then you're done. It is likely that both of these vaccines will have some booster in the fall or in the winter that might be coincident with the flu vaccine, but for all intents and purposes, Moderna is a 2-dose series. Pfizer is a 3-dose series. So you get it day 0, day 21, and then 8 weeks after that shot. So you're looking at your being fully vaccinated about 3 months after you start your series for Pfizer, which is, of course, much longer than Moderna, which you can be fully protected around a month or so. Now, it sounds great and whatnot, but the difference in that is just how protected you are. With Moderna, we're seeing something like and this is protection just from getting COVID. Again, I say that your severe manifestations are protected against whichever vaccine you go with. With Moderna, just your protection against getting COVID, period, is about 41%. In children at this age range. It can be as high as 50% for the youngest group, so that the up to 2-year-old group, and it tends to be a little bit lower, about 38% in the 2 to 5-year-old group. With Pfizer, you have to wait longer, but your protection against COVID, period, is higher. So Pfizer is looking like about 80% protective. and again, it can be as low as 75% for the younger group and 82% for the older group. So, as you decide and think about which vaccines may be best for you and your family, what you're trading off in time is you're getting an increased amount of protection. Now, again, these vaccines were tested or studied in thousands of kids. I think between the two vaccines, there was something like 8,000 children that were part of the study to make sure that these were safe and effective in children less than 5. And so what they found was, that this was highly, effective from preventing severe disease, is variably effective in preventing disease at all, and was really well tolerated. So the reason that they had to do a different study with this is they're much lower doses than what we were giving to adults. So the Moderna dose is a quarter of the vaccine dose that adults got. The Pfizer is a 10th of the vaccine dose that adults got. And so similarly to that, there was actually fewer side effects in kids. The most common ones in Pfizer were fatigue. The most common one in Moderna was fever. And even then, it was something like 25% of kids in Moderna got fever, 5% of kids with Pfizer got fever. And so the side effects, again, were really like small and negligible. That's really kind of, let me think if there's anything else that is really important to state at this time. Yeah, I think that is it. That is kind of my spiel. Hopefully that opens up some questions. And feel free to ask questions about the vaccine, about COVID, about all, those sorts of things. And we will go from there.
Great, thank you so much, Dr. Lim. Attendees, feel free to drop any questions in the chat. And on our end, one that has kind of come through several families that I'll pose to you, Dr. Lim, which I think is actually a question for me, but we can do this one together, is if you have an indication whether quarantine will change for young children once they have the vaccine.
Yeah, I really am hopeful that, especially as we prepare for the new academic year, that there will be changes through the Department of Health and also the Department of Education for our older kids with regards to what quarantine means when there's a vaccine available. And so hopefully what that will mean is, what I would like to see is if there is an exposure, that if you are vaccinated, that you can continue your regular school activities, and you'd have to monitor for symptoms. And then depending, on the specific programs and the statutes from the Department of Health, there may be some form of testing, like a test to stay program where and again, we are so used to this now. If we have older kids, so I have a 7-year-old, the number of times that he has come home with his antigen tests that he's to do on day 0 and day 5 and monitor for symptoms. It has sort of become a fact of life, but the important other fact of life that it's come with is he gets to go to school every day. And so that is really sort of a small exchange for what used to be, gosh, in the beginning, where there would be multiple 5-day quarantines where you would pivot to remote and you would be at home, and we would, have to readjust our lives in order to accommodate. So I think what the availability of the vaccine means will be that there will be more school days in school, which again, I think the benefits of which really are so numerous. So I think that was hopefully what will occur. And then as those come down, of course, we will all discuss how they impact, the day-to-day of the school.
Great. I think here we are all very hopeful and waiting with bated breath for the test to stay protocol to be approved for this age group. So thank you. There's another question in the chat. It says from Deborah and Drew, if a child already had COVID, how long should I wait to get my child vaccinated?
So I'll tell you the things to think about. Your protection from a COVID infection lasts about 90 days. Again, that's an average. It can be a little longer. It can be a little bit shorter. 90 days is also tends to be the limit where most of our quarantine and post-exposure guidelines sort of cover you as far as being relatively protected against the COVID infection. So as if you will recall, it's always if you're vaccinated or within 90 days of your, confirmed infection, then you can follow the same sort of guidelines. I will say this first before it falls out of my head. Again, because most of us are now testing at home, depending on who you're going to get these, to get these sort of guidelines applied, you may need something official that says that you had a documented case of COVID, as opposed to just a home sort of, antigen tests. And again, check in with who you're, who would be pertain to. But my example is for travel. In some places, some folks will still need an official test result from a healthcare provider of some sort, and that may just come in the form of a letter. So the benefit of vaccination overall still outweighs that of a natural infection. It gives you more antibodies, to more varied antibodies than what you would get from a natural infection. And in somebody that had a mild course, they may not necessarily have the same strength of protection from a case of COVID that lasted a day with a little bit of body ache versus somebody who's received the vaccine. And so there's so much more variability in that what I can say is I do know how much protection you can get from a vaccine course. Technically, you can get your vaccine immediately after you have finished your quarantine, your isolation course from COVID. So generally, I would say 10 days after you begin symptoms or tested positive, you're eligible to get the vaccine. Many folks are, chatting with their doctor and saying, hey, should we just wait, and sort of, ride the antibodies for a little bit and then, get our vaccines. And that's a great discussion to have with your pediatrician. Some folks will, treat your primary series differently. So let's say your child has never had vaccines and they got COVID. I might be more on the side of, get vaccinated as soon as you can, as opposed to your 5 to 11-year-old has gotten your 2 doses and then they got COVID. I might be, willing to wait a little bit longer to get that booster dose that's now available. So yeah, again, chat with your pediatrician about it. I am glad that your kids are well, but thanks for the question.
Great, thank you. Here's another one. In the hours and days after my child receives the vaccine, what should I look out for that would indicate an allergic reaction?
Yeah, so most allergic reactions will occur just about immediately after your vaccine is administered. So that was that sort of rationale for that 15-minute window that your kid is running around the CVS making a mess. That is certainly what my son did during his booster. And
same. That was our experience, Joe.
Yeah. So I'm sure they love that. But the medical purpose of that is to annoy the CVS. No, it's to pick up a majority of those reactions. As a matter of fact, I think 9 minutes is the average time for having a post-vaccine reaction. So you are more or less way on the other side of the risk comp by the time you get home from your vaccine. The next day, it's not necessarily allergic reactions you'd watch out for. It is those side effects. Again, kids are getting a much smaller dose than adults. So those body aches and those fevers that we got when we got our vaccines don't necessarily equally pertain to our kids who are getting somewhere between a quarter or a tenth of the dose. And so watch out for arm pain in the site that they got their vaccine. A little bit of like tiredness and fatigue. And again, kids, tiredness and fatigue just means they're not bouncing off the walls. They're just kind of like sitting there quietly and doing what you tell them to do. Sometimes there will be a fever, and those things again can be warded off with a little bit of rest, a little bit of Motrin or Tylenol. And often they're very short-lived. They last a day, maybe two at most, and then your kids are back as they are. Subsequent doses of your vaccine, since this is a multi-dose series, can present with exactly the same things. And again, very, very, very few kids, a much smaller number of children had these anaphylactic reactions to their vaccinations, especially compared to adults, which I'm saying is a small number of an already exponentially small number.
Great, thank you. And it's good to know the real reason of being in CVS for those 15 minutes. Okay, here's another question. For adults and older children, would you recommend getting boosters now or in the fall when the next generation of boosters will become available?
Yeah, I mean, that's a great question. I'll let me talk about what the boosters really are. The boosters are most primarily to prevent you from getting a symptomatic infection. Your primary series has already protected you from severe illness in most cases. And so the boosters are great in giving you that sort of like extra lift, back up to, over 50% of sometimes over 60% protection. So your decision to get a booster probably will depend on the answer to some of these questions. Are you a person that's at risk for having severe illness? Are you somebody that lives with somebody that is susceptible to severe illness? Or do you live with somebody that can't get vaccinated themselves and that or doesn't respond to vaccines? So those are new brothers and sisters that are less than 6 months old. Those are our family members that might be on treatments that make them immunocompromised, or folks that are really elderly that may not necessarily respond as as briskly to vaccines. If the answer is yes to any of those questions, and let me throw in our special parent one, do you want your kids to spend as much time at X this summer, whatever that X might be, camp, grandparents' house, in some sort of like session or whatever, then you may want to get them boosted sooner than later and get yourselves boosted sooner than later. Because what that offers is that protection over, the next couple of months from keeping you from getting COVID, keeping you from bringing COVID home to other susceptible family members, and hopefully keeping you in school or camp or daycare or whatever it is, that extra protection might afford for you. And, if the answer is no to most of those questions or all of those questions, then it's reasonable to think that, in the summer where we probably do more outdoor activities than indoor activities, and that you might sit it out and wait until the fall, until an updated, version of the vaccine will come out that's more directed towards, B4, B5. That's kind of the way that I'll think about it. And so that gives you a little bit of wiggle to decide amongst yourselves, with your family, and with your pediatrician or your doctor to decide what is the best sort of approach for your family.
Great, thank you. Here is another one. How effective is the new vaccine for under 5 in preventing infection in general against the new variant?
Okay, so don't specifically know yet, because B4 and B5, specifically B5, is really new. So I'd say that just came out in the last 6 weeks or so. and again has taken this pattern of quickly sort of overtaking the previous variants. What I'll say is it's still in the same family. So the Omicron variant was the predominant variant when both the Pfizer and the Moderna trials were ongoing. So they were right in the thick of last December, January, February, when they were doing these trials in this younger age group. And so most of the Omicrons are closely related, compared to the variants that are out now. And so again, what I'll say is the Moderna series is about 41% effective in children less than 5. The Pfizer is about 80% more, like 80% effective in children less than 5. And the difference is Moderna is a 2-dose series that you're done in 28 days, and Pfizer is a 3-dose series you're done in 3 months. I'm sure there will be more information as the months roll in that gives us a efficacy rate in these new variants. But what I'll always say is whatever number it is, it's going to be higher than 0. And 0 is your protection rate if you don't get vaccinated. And so it will probably be lower, but getting vaccinated still does offer some protection, if not the protection against severe illness, which we know they all ubiquitously do.
Great, thank you. The next question is the 90-day immunity after COVID infection still valid against the new strain?
Yeah, so it's a very good question. We do see that there are, that the chances of having multiple infections is much higher with these Omicron variants. So yes, we have seen, when Omicron came around, we saw a bunch of folks that had gotten Delta or the original version get COVID again. We are seeing folks that get the original Omicron version now get reinfections. Again, that's certainly more than 90 days. The number of folks that get infections within 90 days is still much lower. But again, like I said, it does vary very differently between different folks. So did you get part of your vaccines or not? How significant or how mild or severe were your initial infectious symptoms? Those can certainly be variable and then make you more susceptible. We've seen, of course, some what we call like rebound illnesses in folks that have taken Paxlovid. Again, point of it is to protect you from getting hospitalized. But what we've seen is you start the Paxlovid, your symptoms go away, your Paxlovid course is done, your symptoms come back. You're still at home, you're still managing, without a hospital bed, but we sort of have seen that. So, that being said, I certainly wouldn't run around willy-nilly that first 90 days thinking you're protected. So if you're still in high risk settings and scenarios, I would still take precautions for that. And again, this is one of the reasons why I think it may be useful still to get vaccinated after your initial infection if you haven't done so already.
Great. Thank you so much, Dr. Lim. The chat seems to have slowed down, so I'll talk slowly for the next minute or so to give anyone who's thinking about asking a question time to formulate that and drop it in the chat. Dr. Lim, this has been really informative and helpful and thoughtful and really given us time to understand. I think there was at one point you said anything is higher than 0%, which is a really important thing to keep in mind. Aha, there is another question. Newlies, I'm glad this helped. So here's another question, which is will vaccinations, this question is for me, will vaccinations for the younger children be mandated for attending school? So that will have to do with what the Department of Health and Department of Education decide. At this point, vaccinations for children are not required. They are for staff, for all staff that is something that is required, but at this time it is not required for children. We have seen, children 5 and up have been eligible for the vaccine for quite some time, and there is no requirement yet or at this point. And so, we as a school will be, the mandates or the determinations will be based on the Department of Health and the Department of Education, which at this point there are not. But as you've heard from Dr. Lim, there are a lot of really strong reasons to think about or receive the vaccine, including a much lower risk in terms of infection and remaining out of the hospital if in fact you do contract COVID.
Yeah. And then again, I suspect that, again, 2.5 years, almost 3 years, like in coming up next March, there's a lot of, I guess, fatigue that will go into this. And I'll be the first to say, as these variants become more contagious, they also become milder. And that's similarly to what we have seen with BA.4, BA.5, is that it is a much, milder compared to original Omicron, and definitely Delta and Alpha. And that can sometimes promote, what we're all seeing as far as like fatigue with this and wanting to get into our normal course of life. My ideal in the future would be that we do treat this illness a lot more like other contagious respiratory illnesses. And if we're looking at the practical matters of why we should consider getting our kids vaccinated, it is the much more day-to-day practical reasons now. It is the not having to stay home in quarantine for 5 days, because you don't have to do that if you have RSV. You have RSV or you have the flu, you kind of are sick at home, and then once your fever goes away and your snottiness is of a manageable degree, you go back to school. You're not automated to stay 5 days or 10 days at home like we still are with COVID. And that's probably the biggest impact that we can have, is keeping our kids in school, keeping them learning, keeping them growing, and waiting it out until those guidelines do change. And this becomes the endemic thing that it needs to be. And then still, masks are certainly still an option. I think that's the other thing that helps a ton as well. And making those, decisions with, your family in order to do those. I will say, the last time we went on vacation, my kid wore a mask for 2 weeks because we wanted to go on vacation. So again, you fill in the blank for what your goal is, for yourself, for your child, for your family, and that can help you decide just all of the mitigation strategies that you may want to consider.
Great. Thank you again. Thank you so much, Dr. Lim. Thank you to all of the folks who joined us today, and those who are watching or who will watch the recording. Thank you for spending time with us. And if you have any additional questions along the way, feel free to email earlychildhood@mannycantor.org, and we will send the questions straight over to Dr. Lim and get back to you. Thank you so much, everyone, and have a great day.
Have a great one, folks. Have a wonderful summer.